Hi there. Welcome to Heal Thyself. Today we're going to be talking about the vagus nerve and vagus nerve stimulation. Hi, I'm Lily Woods. At Body Harmonics, we offer a full spectrum of alternative therapies that may address your health concerns. I'm joining you today from one of my therapy offices, and so I have a lot of my supplies around that we might be pulling into some of the demonstrations that we're talking about today. When we work with clients, we start with a comprehensive assessment of your current conditions and medical history and do a complete and full energetic remote testing on your system. The end result is a comprehensive plan to uncover your journey using multitudes of modalities that we do provide to uncover the journey to your best state of health. And you can resonate and ensure we are maintaining that healthy state over time. Today, we're going to be talking about the vagus nerve. And this quote really stuck out to me as I was researching the vagus nerve and what I wanted to say. A highly important change has occurred in the incidence of disease in our country. Serious infections, formerly extensive and disastrous, have markedly decreased and almost disappeared. Meanwhile, conditions involving strain in the nervous system have been greatly augmented. So this came out in the Annals of Internal Medicine in 1936. Can you imagine how much the strain in our nervous system has increased with cell phone use and the internet expansion and all the other things that we're experiencing today? It's massive. So let's talk about the vagus nerve. What is the vagus nerve? And what does it mean to us and our health? The vagus is the 10th and largest cranial nerve. It wanders through the entire body. It's connected to all the major organs, the skin and muscles, and it's undoubtedly a point we can use to generate great healing within your body. The vagus anterior nerve section keeps each body component working independently, ensuring that all internal processes are maintained. And the posterior manage the perception of social elements and personal security. This is why when we go into a stressful situation, our breathing and heart rate might increase, or other things that might be threatening to us trigger a reaction within our systems. All structures in the body work together for mutual benefit. The vagus nerve plays a crucial role in this. It mediates and controls, reacts to nonverbal language, to sounds, faces, and smells. In this way, everything affects our nervous system, our hormonal system, and our immune system, because our body adapts itself seismographically across all of the different systems. So let's talk a little bit about the sympathetic and parasympathetic systems. The vagus nerve is the main component of the parasympathetic nervous system, and it oversees a vast array of crucial bodily functions, including mood, the immune response, digestion, and heart rate. It connects the brain and the gastrointestinal tract in the brain-gut axis. And it sends information about the state of the inner organs to the brain via the afferent fibers. So what does this mean? And how can we use it for our healing? Let's talk about afferent and efferent outputs and which systems respond to those. When the immune system is challenged, our inflammatory mediators, such as cytokines, are released by activated macrophages and other immune cells. This means when we are feeling sick or something's invaded our body, our cells, our immune cells, some of them called macrophages, respond and they release cytokines. And cytokines are inflammatory. They increase inflammation in our bodies. The neural interconnections in the brain integrate the afferent, which is displayed by the red image, and efferent, which is the blue, vagus output. So both of these regulate immune activation and or suppressing pro-inflammatory cytokines and reduce the inflammation. The vagus efferent output can be supported by auricular hearing input. So sonic stimulation of the vagus nerve can reduce chronic inflammation and support many other functions of the body, including improving cancer prognosis by reducing inflammation, a lot of the other things that stimulation of the vagus nerve can do, or reducing the rate at which we age, which we'll be talking about in a minute, and also boosting sexual function. And because the vagus nerve innervates the pancreas, vagal stimulation offers a potential therapy for diabetes type 1 and type 2. So let's talk a little bit more about the brain gut axis. There's bidirectional communication between the brain and the gastrointestinal tract. And this is sometimes called the brain gut axis. It's a complex system that includes the vagus nerve. The gut is an important control center of the immune system, and the vagus nerve has immunomodulatory properties, which means it can modulate our immune system through the cycle. As a result, the vagus nerve plays an important role in the relationship between the gut, the brain, and inflammation. Sonic stimulation of the vagus nerve, either through full ear headphones, potentially even singing or humming if you maintain the certain tones and vibration for long periods, or by stimulating the targus or other areas of the outer ear where the vagus nerve is accessible, can lead to restoring a cytokine balance and leads to reduction or complete reversal of chronic inflammation. That's really important news. So who wouldn't want to be around the fountain of youth? A lot of us chase youth. We think youth is a state and condition that we all want to be in. There's all kinds of money spent on cosmetics and procedures and everything else about regaining that youthful appearance and healthy state. But what if we could do that with vagus nerve stimulation? This is something that concerns us all at the rate of which we age. There's a study by Bretherton called The Effects of Transcutaneous Vagus Nerve Stimulation in Individuals aged 55 years or above. And it is about daily stimulation of the vagus nerve. The authors point out that the rate of aging is associated with attenuated autonomic function, which means decreased autonomic function, which means the signals to our heart and our lungs, and it's just not working as well. It's just not as effective. It's decreased. Aging is associated with changes in autonomic nervous system function, and it's characterized by increases in sympathetic and decreases in parasympathetic nervous activity. Now, we already talked about how the vagus nerve is one of the major components of the parasympathetic nerve and that structure. So these autonomic changes can be detrimental to our heart function, our emotion, mood, and gut function, and may play a role in the range of conditions that increase the prevalence with aging, including heart failure, hypertension, and depression. These conditions are typically accompanied with increases in medication consumption and decreases in quality of life. Vagus nerve stimulation improved the health in older individuals, as well as increased their independence, quality of life, and mood, particularly depression, which is very interesting. The potential benefits included reduced risk of mortality and reductions in the need for medication and/or hospitalization. The authors reported improvements in participants' vagal tone, and improvements in that tone increase the autonomic tone, and it increased the autonomic nerve function. And it concluded that they had, for the first time, shown that age-related quality of life can be improved via vagus nerve stimulation. That's outstanding. So, how do we do vagus nerve stimulation? There are many different ways to stimulate the vagus nerve. As I mentioned a little bit earlier, there's a lot of implants you can have for certain medical conditions that can be done surgically. That's not what we're talking about here. We're talking about actual therapies that you can go to trained practitioners and get vagus nerve stimulation. You can do this at home, as I discussed earlier, with breathing techniques, meditation, and/or yoga. And to get a more impactful experience, come to a trained practitioner, discuss your needs, and we can find the best stimulation strategy. The aging study that I mentioned previously performed TVNS, which is called transcutaneous vagal nerve stimulation. And it was performed using modified surface electrodes on the tragus connected to the transcutaneous electrical nerve stimulation, or a TENS machine. So there's a lot of different ways you can use that. And one of the ways that we do it here at Body Harmonics is through this TENS machine that you actually place one on the targus and the other through the ear channel. And you're seeing some pictures of that therapy here. So then in doing this and activating the TENS machine, you can stimulate the vagus nerve using alpha frequencies, usually at CES Ultra at 100 Hertz, with trigeminal applications. And these are all valid approaches. There's also some different things you can do with different aspects of the machine, with patches on different areas of your body. It really depends on the condition that you're trying to heal and how you might do this. I'm feeling better already. So once again, we offer a lot of these therapies at Body Harmonics, and I'm really looking forward to talking to any of you about your conditions and your needs and talking about how we can help. I'm very excited to be joining you from my home office today and look forward to next week's presentation. Like us, subscribe, and share this video to whoever you think can help. One of the most important things that I can do is educate and provide this information. And it doesn't matter if you come to us or go to someone else, get some help you need, find these practitioners. It can really change your lives. Thanks for joining us today. See you next week.